Hello, everybody. I will be explaining the difference between sedation and anesthesia. I will be addressing the comparison because a lot of people get confused on the difference. Although they are very similar, they have some differences, so we are going to be going over them. Anesthesia. The definition for the anesthesia. Anesthesia is a medical intervention that prevents patients from feeling pain during procedures. Although that they are very similar, they have different meanings. Anesthesia is also used to put somebody under, but is most commonly used this way. What I'm about to say. Um, Anesthesia is mainly used to numb people or put them in a relaxed state, which is also similar to sedation. So they're very similar. But lidocaine is mainly used to numb or prevent pain from certain areas doctors are operating on. So, for example, lidocaine, doctors would use lidocaine in your mouth before they fix a cavity, fix a filling, replace a crown, take wisdom teeth out, all that different types of stuff. But the lidocaine is also used on the body. A lot of lidocaine can be used pretty much everywhere on the body. It can be used in the toes, the legs, the feet, all those different sorts of locations. And then Novocaine is mostly used in the mouth. I haven't heard Novocaine being used on the body. If so, let me know. But Novocaine's always been known for like oral issues and like related to the mouth. The process of lidocaine is the doctors would either insert an IV or they would give it to you directly with a needle. If they did give it to you directly with a needle, it's just like a shot, except it is in near your brachial artery area, so they inject it there, similar to where they would put an IV. If they use an IV, they would inject it into the IV, and that's how it would go. Sometimes they would use an IV, or they'd inject it directly. Sedation. It refers to the process of putting someone into a relaxed state or putting them unconscious for surgery. People are like, I'm going to sedate him when they're numbing somebody, like anesthesia. I mean, it's kind of there, but it's not how you say it. It's not the appropriate situation to say it in because it's technically inaccurate on your terms. So it's either putting someone in a really relaxed state or completely putting them under. Examples like this would be melatonin, NyQuil, hydroxyzine, and Benadryl. These are all sleeping medications that basically sedate you. They put you under. They get you ready for bed. Non-available surgery use only is propofol. Propofol is what they use to put you under, and they keep that going until they stop the process of injecting the propofol into your body. Lidocaine is also used to kind of prep you. Lidocaine can also be used to relax you. The process of propofol is they would inject it, and the first, I would say the first symptoms you would see is slurred speech. This is because your body is really relaxed and in a really drowsy state once it is injected. The next process would be loss of thought. This is mainly because you are so tired you can't think, and your mind is completely blank. The last symptom you would probably have is dizziness, which I was put under before. How I would describe the dizziness is like vibration, kind of. And that would be the final stage until you pass out. Of course, people experience very different symptoms. This is just me and people I've seen online. In movies, you will see we're going to sedate him, which basically means putting him under. This would be said by a doctor, or, an anesthesiologist, in those types of movies. And they are not referring to anesthesia where they numb you or a pain blocker. No. Think of this as sleeping and then this as numbing. That's how I would view it, to just simplify it. People get these very mixed up all the time. They're very similar. I forgot to go over the symptoms for anesthesia. Anesthesia, once it is injected into your body, you will not feel anything at first, and then you will slowly lose your sense of feeling in that area. Once it is there, it remains there for either 30 minutes to hour to 2 hours to all day, maybe. Okay. So that is basically all. Those are the differences between those both. I know I'm not a doctor, I'm not an expert, but I think this is how you would simplify both terms because people get them mixed up all the time. Thank you guys so much for watching.